Hi, welcome to what's happening. Here are the top 5 stories. At number 1, the Department of State Services has given the Nigerian National Petroleum Company Limited and all marketers a 2-day ultimatum to make fuel available for Nigerians. DSS spokesman Peter Afunaya announced the directive while briefing journalists at the DSS headquarters in Abuja after a closed-door meeting with stakeholders in the petroleum sector. He said failure to comply with the DSS will activate its operations across the country. This is not the first time the DSS will get involved on the fuel scarcity issue. In January 2018, under the Maikanti Barry-led NNPC, the federal government enlisted the DSS and other critical stakeholders to put an immediate end to the fuel scarcity. In Ogun, the state government enlisted the state DSS as well as other stakeholders to give them a 48-hour ultimatum to put an end to fuel scarcity in the state. In November 2015, under the Ibe Kachiku-led NNPC, the DSS was also called in to intervene in the fuel scarcity crisis. At number 2, despite several criticisms and an order given by the House of Representatives to halt the withdrawal policy, the governor of the Central Bank of Nigeria, Godwin Emefiele, has revealed that the withdrawal policy announced recently could be adjusted after assessment but not stopped. Emefiele said the central bank will not be rigid towards the policy, but the financial regulator had no plan of suspending it. He said after meeting with President Buhari on Thursday, the Apex Bank backed the president's support for the policy. At number 3, the government of Anambra State has debunked reports stating that there was an attack on an unidentified hospital and babies were abducted. The state government said no babies were kidnapped anywhere in the state. This was contained in a press statement by the Information Commissioner, Sapo Umusu. He also stated that the speculation was mere fictitious. At number 4, the World Health Organization says Nigeria is home to 50% of Africa's neglected tropical illnesses and has the highest rates of tuberculosis, pediatric, HIV, and malaria in Africa. The WHO country representative Dr. Walter Mulumbo disclosed this on Thursday in Abuja at the 6th annual conference of the Association of Nigerian Health Journalists. Mulumbo, who was represented by the Field Present Cluster Lead at WHO, Ahmed Kadar, said non-communicable diseases account for 29% of all deaths in Nigeria, with premature mortality from the 4 main NCDs, which are hypertension, diabetes, cancer, and malnutrition, accounting for 22% of all deaths. At number 5, French President Emmanuel Macron accused TikTok, the Chinese social network, of censoring content and encouraging online addiction among young people. The French president said the app is the most disruptive, psychologically, however, the most effective network among young people. TikTok has received a lot of negative and positive criticisms since its inception. Recently, an alarm was raised regarding an invisible challenge. Also, according to reports, it was also sued over safety and privacy of children. That's all for now. See you next time on What's Happening.